Did you know that almost half of a nurse's tasks involve clinical decision-making? Yet most graduate nurses who pass the NCLEX do not possess the clinical judgment skills essential for safe practice. To prepare for the upcoming NextGen NCLEX, many educator-based resources emphasize using the complex alternative test items that will be used on the NextGen NCLEX, including matrix multiple choice, drag and drop down close items, and more. Yet these items share one common feature. They are variants of multiple choice test items, just more complex. Although the majority of NCLEX consists of multiple choice items, these questions are meant to evaluate clinical judgment, not teach clinical judgment. NextGen multiple choice test items do not replicate the higher level thinking required in practice, since the nurse must know what to do and doesn't have a list of responses to select from. To help your students pass NextGen and transition successfully to clinical practice, Keith Arren has developed a new level of concise, innovative, unfolding case studies, NextGen Reasoning. NextGen Reasoning provides a separate medical record and the same 6 questions students will see on a NextGen unfolding case study. But instead of using complex, alternative item types with multiple choices, NextGen Reasoning uses mostly open-ended, concise responses that simulate the thinking of real-world practice. Since NextGen Reasoning has only several questions and captures how a nurse uses the nursing process and clinical reasoning, it can be easily implemented across the curriculum at all levels in the classroom, clinical post-conference, or as a pre-briefing activity for simulation. Consider the additional learning and practice-informed benefits of NextGen Reasoning compared to traditional NextGen case studies that include an electronic medical record that simulates the formatting of data seen in clinical practice, questions with open-ended responses to replicate the thinking used in practice with no multiple choices to choose from. Require students to identify the rationale for each answer to the case study so faculty can better evaluate their thinking and identify clinical judgment errors. An additional question to identify the current nursing priority and plan of care to replicate the cyclical nature of the nursing process, which NextGen cases do not do. Reflection questions at the end of each case study to further develop clinical judgment are also provided. To develop the thinking skills of the NextGen single item, bow tie, and trend items, concise bow tie and trend case studies are exclusive to the all-inclusive faculty membership, Think Like a Nurse. These bow tie and trend style cases contain an additional 2 to 4 questions to further break down the thinking required for these complex items so students can apply these additional reasoning steps on the NCLEX. Learn more about how you can use these new resources to transform your teaching and better prepare your students for NextGen and professional practice.